today's program. I am Emma with Becker's Healthcare. The program will begin with a presentation, and we will have a question and answer session following completion of the presentation. You can submit any questions you have throughout the presentation by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. Our presenters will attempt to answer as many questions as they can during the time we have, and will follow up with questions they do not have the opportunity to address. You will receive an email within about a week following the webinar that will include instructions for how you can download a copy of the presentation. You will also receive a follow-up email shortly after completion of the program. You can submit your feedback or any additional questions at this time. This email will not include the presentation. It is now my pleasure to introduce today's presenters. Jennifer Dunphy is a clinical subject matter expert for Get Real Health, and Damon Auer is the Vice President of Healthcare for TriBridge. And now, it is now my pleasure to turn the floor over to Damon to begin today's presentation.
Thank you, and hello everyone. This is Damon Auer. As I was introduced, I'm the Vice President for Healthcare at TriBridge. And I just want to thank everybody in advance for the next 45 minutes or so of your time and attention. It's gracious of you to spend it with us. What we want to spend our time talking about today and sharing with you a point of view, and then hopefully getting into a healthy Q&A towards the end, is really tackling the question of how do we achieve care coordination and population health objectives, particularly in this post-EMR, EHR world that we're living in as we transform the system into a health system instead of a health care system, and really put the consumer and or the patient at the center of our processes, leveraging the electronic medical record and the plumbing of the EMR. Hopefully we've all stabilized the plumbing of the EMR at this point. Leveraging EMR is a great first step, but it isn't going to get us all the way there, and it's not the whole story. The social determinants of health and simple preferential treatment items for individuals play a huge role in a person's overall health and well-being. As the healthcare industry continues this shift to value-based payment and accountable care, healthcare provider organizations of all sizes have really renewed a focus on this challenge of coordinating care outside of our own physical facilities, which places an enormous emphasis on continuity of care and collaboration among healthcare providers, which is ultimately enabling a shift from what has historically been provider-centered and a provider-centered environment and set of processes to a truly customer and patient-centered set of processes and environment. An exciting transformation, to say the least. If we could advance the slide. Let's start with some quick statistics, and I won't spend a lot of time here because I know we're all sometimes over-inundated with the data points that we're seeing come out of the system. But let's just acknowledge the fact that nearly half of the U.S. population suffers from one of the top 7 chronic diseases, and we know what those are: cancer, diabetes, hypertension, COPD, heart conditions, and in some cases just behavioral and mental illness. 75% of the healthcare costs in the U.S. go to us providing care for those 45% of Americans that suffer from one or more chronic diseases, and the cost for us to provide ongoing care for those people is 5 times higher than for those without. If we can advance the slide. This is an interesting data point from class research, and really is just emphasizing the fact that the shift to value-based payment processes and organizations and people and systems is happening, has happened, and continues to happen a lot faster than anyone thought it would, including the folks at Class Research, who have a fairly unique vantage point on the market. And as you'll see here from their own data, and this was a survey from late last year, so it's already a little bit out of date, and we may have accelerated past this point. But you'll see here that 62% of healthcare providers have already adopted a value-based set of processes and organization, people, and systems, leaving just 38% who are still taking a wait and see, let's see what happens point of view. And I'm not much of a betting man, although I bet occasionally, but I think we could all look with a little bit of anticipation towards those 38% that are just sitting on the sidelines as the value-based health story plays out around them, and I suspect some large proportion of those 38% will not exist 6 years from now. Does anybody else think that the term population health is a pretty jarring oxymoron? Because it's always felt that way to me and to our healthcare team here at TriBridge. Population health, just by definition, sounds wildly impersonal. It implies that we're impacting groups of people, not individuals. But the irony of it is that to achieve the triple aim of population health actually requires effective engagement and ongoing persistent collaboration with people at the individual level. And we'll talk more about how we are enabling that set of processes and systems today using CRM software, which is customer relationship management. I'll talk a little bit more about that, and new and innovative mobile tools. Next slide. Here's another just interesting shift in data point on the consumerization of care and the fact that we are seeing more and more primary care physicians start to open a concierge service with flat fees, and not surprisingly, with the shift in the way things are getting paid for here, that trend seems to be continuing. More and more payment is coming from us as individuals via higher deductibles and other methods where we are seeking out care directly and using the information that we've got to really guide those decisions. Next slide. Other items just really driving this consumerization of care trend, and I think this is one of these things that we'll look back 5 years from now, and similar to the class research that we just saw on value-based payment, we'll look back 5 years from now and say, wow, nobody really expected the consumer to take that much control that fast of the way that the healthcare system is structured and healthcare services are delivered. And there's a few reasons for that, and you guys will all be familiar with these, as we are all consumers and will all one day be patients if we are not already. But things that are making it easier for us as consumers to really make choice and impact this change in healthcare include accessibility. We have a lot more information available to us, and connectivity. We have that information available to us all the time. Everywhere that we are, including when we're sitting in a waiting room for an episode of care, and we can even make last-minute decisions all the way up to that moment we walk into the room with a caregiver, and the pervasive mobility of those connections. Next slide. If you ask me, this is incredibly refreshing, by the way. I don't know if my optimism is coming through on the phone, but it's incredibly refreshing to see the health system begin to think about each of us as individuals and the needs that we have, and beginning to be proactive about the way that we engage. Here's another interesting opposite set of terms between just the words that we use, the word clinical and the definition of that word versus the word personal. Because if we believe that a personal care experience is going to have a better outcome for me or any of us than an impersonal one, we have to begin to take this stuff seriously. But the definition of clinical, straight out of the dictionary, is efficient and unemotional and coldly detached. And there's no question that we want our caregivers to be as up-to-date as possible on best clinical practice, but we don't want to feel a coldly detached person or persons on the other side of a care services experience. The definition of the word personal, in sharp contrast, you can see here, is of or concerning one's private life, relationships, and emotions. These things that have just as big an impact, maybe even more, when you look at some of the social determinants of health studies that are out there than what we do clinically for a person. Next slide. So all of this is driving our thinking and our in-the-market approach with the customers that we're fortunate enough to work with in the healthcare provider industry, is really getting us to focus on people, not patients, but people, and recognize, and we're going to use Bob for the next few minutes in a number of different scenarios, but I wanted to just quickly introduce you to Bob and highlight a couple of things. One, he's not just a patient, he's Bob, which is catchy. But the point is that patients are people first. Let's learn what we can about them as people, and then make best use of that information to improve the experience that this person, this individual has with our health system. So what do we know about Bob? We know he's a boating enthusiast. He's a relatively young grandfather in his early 50s. He's diabetic, and he's allergic to cats, or at least he says he's allergic to cats. We'll see what we can find out about that. Next slide, please. So let's talk just for a few minutes before I tee up some just some story vignettes that I think will give you a better idea of what we're talking about here and how we can impact the care experience that we as individuals have. So a little bit of background on the customer relationship management concept. Customer relationship management was a substantial business strategy initiative in the early 90s, and subsequent to that business strategy, and the strategy really was to say, hey, let's stop organizing our company around our own supply chain and warehouses and so on, and begin to reorganize our company around our customers. Let's listen to our customers. Some of you will be familiar with the whole Six Sigma voice of the customer concept. But let's listen to our customers and let's re-engineer our business, people, process, and the systems that support them to be a real customer-focused and customer-centered organization from before the time that we have secured someone as a customer until well, in perpetuity from that time forward. So that's customer relationship management as a strategy. CRM, the acronym is used now frequently to describe a set of systems that were created by some pioneering software development organizations, including Microsoft, Salesforce, and Oracle, who started to create customer-centered software solutions back again in the early part of the 90s. So we've been at it now for over 20 years from a system investment perspective. And these companies have spent those 2 decades and tens of billions of dollars developing customer-centered and customer relationship management software that matters. And I will tell you why I'm giving you this background here in a moment. We at TriBridge, we're one of Microsoft's largest partners in the U.S. We roughly 4 years ago, in decomposing the accountable care challenge as we saw it at the time with a group of clinicians in the health solutions group at Microsoft, identified the CRM platform as a great starting point for what is a complex set of relationships, customized, proactive product configuration or care planning in this case, and then ongoing field service coordination and customer satisfaction management. These are all functions that have already been hardened for us on a CRM platform. So we at TriBridge, as we were looking at the first challenge in accountable care, which we identified as care coordination across physical locations, we chose to build our TriBridge Health 360 solution on the Microsoft Dynamics CRM platform. And that really powers what you're going to hear for the next few minutes. One other thing is that just this concept of customer relationship management and customer-centered processes and systems is really trending in healthcare right now. as I hope many of you who are on this webinar with us today, this may have a lot to do with the reason that you're joining us, is that you're starting to hear this out in the market. CRM's trending. Dr. Topol's new book, The Patient Will See You Now, is a great way to break some of the way that we have thought about the very provider-centered processes that we've put in place in the past are now switching to a patient is in the middle of the cockpit and sort of orchestrating the resources around them. The fact that we're really talking about perpetual relationships with our patients, not just episodic related to an episode of care, but perpetual and proactive and planned, so that none of us are surprised, either the patient or members of the care team. The notion of patient and family engagement, we'll hear more about that and what we're seeing and learning on that topic here in a few minutes. Value-based payment, which we've already talked about, the consumerization of care. Here's a quote from a chief medical officer that I heard late last summer that I thought was great. It said, "We need a solution that is equally meaningful for healthy as well as chronic people. We need to convert consumers to loyalists." And he very consciously was not using the word patient. And then finally, the rise of the chief consumer, chief customer, chief experience officer in many of our healthcare provider systems. So I'm going to move from here. There's really 4 components, and you'll see them on screen here. Care coordination as a topic, customer experience as a topic, customer engagement, and optimizing the provider network. And I'm going to take just a quick time check, the next 10 minutes, maybe 12, to walk you through some real-life scenarios that we've seen in each of these areas. If you can advance the slide. So let's talk about a delighting customer experience. And I'm going to use 3 personas quickly in this story. Bob, who we've already introduced, is in his mid-50s. He's a consumer, not a customer. He's not a customer of our health system yet. Moved into the geography roughly 5 months ago. By the way, our health system, for purposes of this story, is called St. Benedict Health System. So Bob is a mid-50s consumer, just moved into area, and is a marketing manager at St. Benedict. And Jack is a member services rep in the contact center at St. Benedict. So the story here, leveraging the Health 360 platform, is that Ann and her marketing team have been running a 6-month multi-channel campaign, so including print, radio, billboard, digital advertising. And they're really focusing on 2 things. One, it's an ongoing brand enhancement campaign for St. Benedict and the geography, and it's also an opportunity for us to aim to acquire new customers to our St. Benedict health plan, which has been recently launched. So we've been running this campaign for a while across these different media, and we've recently included a low, or in some cases no-cost primary care incentive. We're really targeting 2 different segments of the population and geography: families and individuals, individual health plan buyers, or who we think might be individual health plan buyers over the age of 40, who we have reason to believe can't afford it. So Bob, in geography, he witnesses this campaign on billboards and print and digital, and also sees an entry from one of his buddies on Facebook just saying, "Hey, my family just signed up for the Silver St. Benedict Health Plan. Seems like it's going to be pretty good. Maybe you should check it out." So Bob picks up the phone and he calls in to the St. Benedict call center and talks with Jack and says, "Hey, I want to learn more about these health plans, both the bronze and silver St. Benedict health plans," which Jack does a good job of educating him. Interestingly enough, even though Bob is not a customer of our health system, Jack already knows a little bit about him when he calls in. So based on the phone number that Bob is calling from, the system Jack is using identifies the fact that this is Bob. We have a little bit of demographic information on him, including date of birth, some recent employment history, and so on. So even though Jack is interacting with Bob for the very first time, he can make it feel just a little bit better that we know, Bob, that you exist, and we're happy that you called in to the St. Benedict Health System. The story ends with Bob having selected a plan, and Jack electronically sends to Bob the paperwork that he needs and so on, and schedules his first primary care appointment in network. Next slide. Now let's talk briefly about managing care coordination. Now we know a little bit about Bob because Bob's a customer and Bob has gone to see his PCP. So we've got some clinical background on him. Let's now talk about what we can do, just by way of one simple example, what we can do to begin to personalize Bob's care experience with the St. Benedict Health System. And we're introducing one new persona here, and that's Ethan, who is Bob's care coordinator. So once Bob signed up for his St. Ben's health plan, he had his first primary care visit. PCP captured some information in the EMR. Some of that data made its way to our Health 360 platform. And Bob was automatically assigned to Ethan because Bob's PCP documented the fact that Bob is diabetic. So he was automatically assigned to Ethan because Ethan specializes in coordinating care for diabetics in Bob's age group. So once Bob gets that assignment, he reaches out to Bob via email to schedule a one-on-one opportunity to interact, which they do manage to get together inside of a week or two and discuss Bob's health goals, issues, and create a personalized care plan for Bob that is inclusive of the clinical protocol best practice informed by the care plan template for diabetes for males in this age group, but also includes what Ethan can learn about Bob in terms of his lifestyle, his preferences, and other things that will impact our ability to provide a personalized care experience. Habits, behavior, support mechanisms or lack thereof, etc. Bob admits to Ethan that he's not actually allergic to cats, but he's always told people that because he doesn't like them. So we know that we don't need to put him on any cat allergy medicine. Bob also identifies communication preferences, which go in, not surprisingly, this order: text me first, then email me if you have to, and only call me if it's an emergency. And Bob also expresses the fact that he's very interested in leveraging telemedicine and video visits with Ethan and other members of the care team. So he's hoping that that will be relatively easy to do. Bob also agrees to an exercise goal of at least 3 45-minute active sessions each week. Ethan helps Bob schedule his next several appointments, which are all just based on his proactive care plan. We know the appointment specialist he needs to see and in what time frame. Ethan sets that up for him and shows Bob how he can very easily get onto the portal and see those upcoming appointments himself or make adjustments, or if that's too difficult for him or just too much of a hassle, just message Ethan. An electronic message to Ethan, and Ethan will be your permanent concierge and guide as you make your way through life with the St. Benedict Health System. Next slide. Customer engagement. This is a tough one, and Jennifer's going to spend some time telling us more about what we're actually learning with customers in the market. But let me give you a story scenario. We have Bob still in persona, Ethan, his care coordinator, Jack, member services rep, and Ann, the marketing manager, is back into this story as well. Now that Bob is a member, we campaign to segments of our member population differently, or can choose to, than the population at large in geography. So in this case, Ann and her team are running a campaign specific to members who have a chronic condition, are over 40, and have indicated a preference for electronic communication. And the campaign aims to get as many of those members to download and begin to make use of a mobile app called St. St. Benedict's Healthy You. And so we're encouraging them to do that via an email and electronic campaign. Bob eventually downloads the app, and his care coordinator, Ethan, is automatically notified of that event. Ethan texts Bob and asks if he needs any help with the app setup, which he doesn't. Bob's pretty technology literate. He sets up the app, and he gives consent in the app to share certain self-reported data that the app's going to collect for him with Ethan, his care coordinator, so that Ethan can, again, continue to help guide the next best action of the health system with respect to Bob. So Bob agrees to share his exercise information, as that's part of his agreed care plan with Ethan, and also agrees to let Ethan monitor his self-reported blood glucose and weight readings. A couple of months later, Ethan is alerted to a nephrologist appointment that Bob just missed, and that appointment needs to be completed inside of 30 days to just maintain compliance with Bob's care plan for diabetes. So Ethan takes the proactive step of scanning the network for available appointments that, based on Bob's preferences and what he knows of his schedule and preferred visit locations, he identifies and holds 2 nephrologist appointments that he thinks are going to work for Bob, and then instant messages Bob, hey, I've got these appointments ready for you. Pick one. Bob does, and you can see the experience that Bob just had as a member on the other side. It's a dead simple experience, and the only way to really get patients to engage or customers to engage is to provide them value. And so what we just did in that short story was give you an example of the value that we can provide to Bob to keep him engaged in his own care plan process. Advance the slide, please. This is the last one, quick story on optimizing the provider network. How do we do this, and how do we leverage our Health 360 CRM-powered solutions to help you optimize the provider network? Dr. Shaw is a new persona in this short part of the story, a nephrologist in our network. Shelley is a nurse liaison whose job it is to call on physicians like Dr. Shaw to do a couple of things. One, optimize the in-network referral volume. 2, get a sense for the patient experience at that doctor's location. And 3, help that doctor and any of the team in the physician practice resolve issues that the health system can help resolve. So Bob ends up getting an appointment with Dr. Shaw. That's the nephrology appointment that he picked, one of the ones that Ethan offered him in the prior scene. Bob keeps his appointment with Dr. Shaw, but he's late for the appointment. And right before, a few minutes before the appointment, he calls in. He's really frustrated. He talks with the practice manager in Dr. Shaw's office and says, I can't find parking anywhere. This is a huge hassle. It's going to take, I'm going to be 15 minutes late. And he does end up being late, and he's kind of flustered and frustrated when he arrives. So Dr. Shaw's practice manager immediately captures that as a right now patient satisfaction issue, and one that will continue to be a future patient satisfaction issue if we don't do something to change that frustrating parking situation. So Shelley, the nurse liaison, is planning her week and can see the capacity and referral volume for the 100 physicians in the network that she is assigned, including Dr. Shaw, who she's going to visit tomorrow. It appears to her that Dr. Shaw has capacity to see more in-network patients, and Shelley makes a note to confirm that fact when he sees him tomorrow. If so, she will make that information available to the business development team that is also using the same system and prioritizing their M&A activity around additional physician practices. So the next day she does make the visit, and she agrees to take point on helping to resolve the potential patient satisfaction parking issue so it doesn't remain an issue in the future. And Dr. Shaw's practice manager on an ongoing basis can very easily see the status of the resolution of that issue in her practice dashboard. Let's advance the slide. I'm going to stop there. Those are just some quick story examples of how the platform can be leveraged and is being leveraged by our customers right now. A quick quote on the screen here, and I won't read it. You guys can read, but it's worth mentioning. Virtua is a customer of ours in southern New Jersey, and this is a quote from Al Campanella, their Executive Vice President for Strategic Business Initiatives, who bought and implemented our solution in 2013, so have been live for over a year at this point, running dynamic CRM to really serve as the care coordinator's cockpit. This is their words, in the ACO. So everything that a care coordinator needs to see to really make a good decision about a next best action to take with any consumer or patient in the attributed life population is represented there. There's a case study on this particular customer available out at tribridge.com. I won't belabor it. I'm sensitive to time. If we can advance the slide. So key message to just leave with you guys before I turn over to Jennifer is that as this healthcare transformation continues, it would be silly for us to not look for best practices and techniques for customer engagement and customer service personalization from other industries that have spent several decades and tens of billions of dollars to try and figure out some of these problems. And that's exactly what we at TriBridge have aimed to do by leveraging the Microsoft CRM platform. Here's one that sounds like an oxymoron, but actually isn't if you have the right CRM processes and systems in place, and that's the notion of mass customization, because what we cannot afford to do is engage the way that I just described in these preceding scenarios with consumers and with patients if we can't find a way to do that efficiently. It will just become too cost prohibitive, and it already costs way too much for us to provide care as it is. So you can really think of the CRM system and the TriBridge Health 360 solution built on that CRM platform as an accelerator for helping a health system provide personalized care, but being able to do that at a mass scale. If we can advance 2 slides. I'm going to turn it over now because no component of this puzzle is more unclear, quite frankly, yet, than the topic of customer engagement and what it takes to achieve meaningful, sustained customer and patient engagement continues to be a moving target. Our partner in this particular function, this critical function, is Get Real Health. And Get Real Health provides our customers with a world-class portal and mobile app experience that we've already integrated into TriBridge Health 360 and the Microsoft CRM platform. Jennifer Dunphy is a clinical subject matter expert with Get Real Health. Prior to joining Get Real, just a couple of years ago, she was an oncology nurse for over 20 years and specialized in serving breast cancer patients for 9 of those years. As a registered nurse, she ensures that the caregiver's perspective remains top of mind, and with years working one-on-one with chemotherapy patients throughout the course of their cancer treatment and all of the follow-up care required, Jennifer has a really unique breadth of experience surrounding patient engagement. Jennifer, if you're ready, I'm going to yield the floor so that you can provide some more info and lessons learned out in the real world on the very real patient engagement challenge.
Sounds great. Thanks so much, Damon. If we could have the next slide, that would be great. So as Damon said, I am from Get Real Health. I'm a clinical subject matter expert with a history as a nurse, and I'm going to talk a little ways through how we engage patients using mobile technologies, and especially one case study that we've done with our product to show how powerful mobile technologies can be in healthcare. So at Get Real Health, our product, Instant PHR, is not just a standard patient health record, but it's a patient engagement tool that empowers patients with the means to actively manage their health. Not only can patients view their data, which is so important, but it comes to life through our dynamic interface. As such, users can comprehend and use the information both for self-management and for collaboration with their caregivers. Next slide. Thanks. So using tools like Instant PHR, we can put Bob in the center of the health system. As it shows here, I just renamed him Bob after listening to Damon. So using tools like Instant PHR, the healthcare team can use all available resources to provide the best care for the patient, keeping in mind that 99% of all care happens outside of the immediate care of a provider's office or the hospital. It's imperative that we leverage all patient data available. So ideally, a robust patient engagement tool brings all of the patient's data together in one usable format. This format enables patients to track trends in their care and helps them modify behaviors to improve their health. This data can be pushed back to the provider, giving the provider a better snapshot of the patient's profile, a complete picture that's not available when you have the limited access at an annual visit or in between checkups. Next slide. So now we know what the patient needs to effectively manage their care, and here we can see that 66% of Americans want to use a mobile app to manage their health care. Next slide. With the ever-growing use of smartphones and other mobile devices, we need to take advantage of these powerful tools to drive medication adherence and improve outcomes. We know that 2/3 of all Americans have smartphones, spending an average of 34 hours per month using mobile apps and browsers, unless, of course, you have a teenager, and then it's much higher. We also know that 78% of adults with chronic conditions own their own cell phones. We need to leverage this knowledge to engage patients where they are, using simple tools like push notifications that pop up on a patient's phone that we're all used to responding to. We can drive patients to stay on track with their health care as easily as you can be notified when someone posts on your Facebook wall. Next slide. Based on the stats that I just mentioned, the key is to put the power of mobile health tools directly into the palm of the patient's hands. We all need to work together to bring health care to the patient wherever they are. In the fast-paced world that we live in, if we don't do it when it pops into our heads, we don't do it at all. And this becomes particularly important when we start talking about medication adherence. Real-time alerts and reminders are incredibly powerful tools when it comes to getting patients to take their medications. What we know is that 75% of adults have been found to be non-adherent in one or more ways. Half of all patients do not take their medications as prescribed. Adherence is lowest in patients with chronic diseases, and poor medication adherence results in 33 to 69% of medication-related hospital admissions in the U.S. at a cost of roughly $100 billion a year. These are incredibly powerful stats. And these stats can span all demographics from age to education level. So as an example, I have to throw myself under the bus. I'm a nurse, and I have to receive a notification to my phone every morning to remind me to take my medications. Because honestly, I have too much going on in my life with work and family. So the last thing that I would remember to do is take my medication. But as soon as the notification pops up on my phone, I do it and I take my medication. Next slide. I'd like to show you how powerful mobile health tools can be in real life. Beyond medication adherence, mobile applications can be used in any chronic disease setting. In the study that I'd like to share with you, one of our clients used mobile technology to care for their mental health population. In collaboration with Loss and Health Research Institute and TELUS, 400 participants were identified to participate in the Mental Health Engagement Network project. The aim of the project was to give participants control over their mental health by tracking their moods and medication, as well as provide access to direct communication with their providers outside of their regularly scheduled sessions. Next slide, please. The objective of this project was to improve the health outcomes and quality of life for people living with psychotic or mood disorders, put novel technology in the hands of clients and their team, and to deploy and evaluate the benefits of an electronic patient health record, which includes patient access to their own health record, their own health information, interactive tools such as mood monitors and mood journals, standardizing health services through customized care plans, ongoing monitoring of activities with alerts and reminders, and regular communication between patients and their care teams. Next slide. So for the study design, the care providers were recruited to provide client care using new technology. The research participants were those who had been diagnosed with a mood or a psychotic disorder, and then were recruited from either outpatient or community-based programs. The technology that was used was a smartphone, and they were given access to Lawson's Smart Record, which is a version of our instant PHR. Next slide. This is just a quick look at the mobile patient engagement platform that was used. You can see here that the patients were able to use their smartphones to easily answer questions about their symptoms, their moods, and their habits. Next slide, please. So let's take a look at some of the outcomes. Here we can see what sections of the tool were used, how many times, or how many hits each page received. You can see that in this population in particular, the health journaling is an incredibly useful tool. And we've seen this across many different disease states. We have seen that this population in particular feels that they benefit greatly from being able to use their mobile device to record their symptoms and their feelings. Next slide. The initial data that came out of this study proved that by using a product like Instant PHR in the mental health population, we were able to decrease psychiatric admissions, keep patients compliant with seeing their providers, improve their health care, decrease the number of ER visits for psychiatric reasons, decrease the numbers of calls to their crisis line, and even to 911. And in fact, they were actually able to tie the use of the tool to a decreased number of arrests in this population. On the financial side, you can see here that using this tool showed a decrease in healthcare costs of over $240,000 over the course of the study, which is a 40% return on investment in 6 months. So pretty incredible results. Chronic conditions posed costly challenges and have significant impacts on patients' mental health, as well as physical well-being. So through the Lawson study, we found that a mobile patient engagement platform that offers online journaling, messaging, appointments, reminders, and daily tasks can be an effective aid to talk therapy. We not only saw that a mobile technology can lead to positive outcomes on key clinical and financial metrics, but we saw that these patients were more likely to use this sort of technology over longer periods of time. Using this approach in any chronic disease can help improve outcomes across the healthcare spectrum. Next slide. So at Get Real Health, we really feel the patient needs to be at the center of the care team, just like we showed in that slide above, so we can really help them achieve the best possible outcomes. So by pulling together data that's traditionally been siloed in one place, we can give both the patient and the provider a more holistic view of a patient's health and better personalize the patient's experience. Armed with this comprehensive data, care teams can make informed decisions resulting in better health outcomes. So we know that consumers use their mobile apps in all aspects of their life, and it's become ever important to bring healthcare to the mobile world. Thank you.
Thanks, Jennifer.
Great, wonderful. Thank you so much, Damon and Jennifer, for a very informative and enjoyable presentation. We will now begin the question and answer portion of the program. As a reminder, you can submit any questions you have by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. Our presenters will attempt to answer as many questions as they can during the time we have for Q&A, and will follow up on questions they do not have the opportunity to address. Rich, I'll turn the floor over to you to begin today's question and answer session.
Thank you, and I'm Rich Nero, Director for Healthcare Business Development for TriBridge, and I'm going to encourage everyone to submit questions now if you haven't already done so, and I'm going to summarize for the sake of time some of these questions so that we can move through. The first one comes, Damon, to you. You would walk through several scenarios with Bob. There were a lot of people touching Bob. The question is, what's the care coordinator's role in this, and how does he get information from everyone else?
Yeah, good question. The care coordinator, the way that we have approached this is that the care coordinator is the quarterback of the care team, right? And the care team now, because of the tools that we can put in place for use by the care coordinator, but also software used by Bob and family members and supporters that he has really makes Bob and that team all an inclusive part of the care team as well, right? So we've got our professional licensed caregivers that are employed by the health system and have a set of tools that give them a complete 360-degree view of everything that's going on with Bob, every single touch that the health system has ever had or intends to have, because you'll remember this, we've emphasized the proactive nature of this over and over and over again. If we're not proactive and persistent in managing that relationship, it's not going to serve Bob or the health system as well as it could. So tools for both the extended care team members, which include the patient and their family and support mechanisms, and all the members of the care team, care coordinators, and quarterback.
Perfect. Another question comes in. Many pharmaceutical companies are offering incredibly detailed online support and tracking tools for certain disease states. How is your program for patient engagement any different?
Any different than a specific pharmaceutical supplier's portal and patient tools is what it sounds like?
Correct.
Yeah, okay, I'll do my best to answer that question. What was just described there in that question, if I understand it right, is a why is the pharmaceutical company providing that tool, and what is the sort of engagement that we are getting or can we expect from a consumer population? I guess I would fire back a question on that one to try and better understand the difference. But essentially what we've described today and what we're in the market helping healthcare providers do today is to create proactive perpetual care plans that are inclusive of the stuff that we know clinically and the stuff that we are able to learn over time, the non-clinical stuff that has so much to do with our health and well-being and ability to recover and quality of life and so on. So without seeing a specific tool, I may not be doing the best job of answering the question, but in general, it sounds like a pretty limited function set sponsored by a pharmaceutical provider. Now, that said, I have seen some condition-specific communities, digital communities that have been created by consortiums of pharmaceutical providers that can serve as a really great digital support mechanism online. But does it meet all of your care plan needs with the health system? No, it does not. So I think that's really the differentiator.
Okay, and there's a question early on about will we be at HIMSS, and certainly want to call this out right now because I see some people are dropping as we get to the top of the hour that TriBridge will be in the Microsoft booth at HIMSS. We strongly encourage you to come by. That booth number is 1202-1202, and Get Real Health will also be in attendance. I believe there's some display in Microsoft, but also at their own booth, which is 8736. So for those that have to drop off, we will be together again at HIMSS if you're attending, and would love to be able to interact more. A couple of patient engagement level questions here. Jennifer, maybe these might be towards you. I'm going to ramble off a couple of these. Is this native to iOS?
So we have a mobile app that can be used on any cell phone. I have myself, we actually all have in the office, but you can use it in the Apple or iOS. So it does span the technology of the cell phone.
Okay. And just to add to that, I use it on my iPhone.
So.
Language barriers. Does with Instant PHR, how
Yep.
would you engage consumers in that regard?
So we can actually localize in any language. We have capabilities not just in standard alphabet, but we can localize in right to left. We have translated even into Arabic, but in some of our hospital systems, we engage in multiple different languages. So that's actually something that is built right into the product.
Excellent. In general, there was a mental health example given. Do you expand beyond that? And
Sure.
if so, can you summarize?
Absolutely. So we can really, Instant PHR is such a flexible platform that it can really span any sort of chronic disease or wellness. In that, my love and my history is in oncology, and I really see a tool like this having great benefits in the oncology research world, or really in any research world. So often we see in clinical research that data is just not captured. So patients are either, their data isn't used in the study, and it takes longer to get new drugs to market that way. So if we can capture all this data, having surveys and questionnaires and symptom trackers right in people's cell phones, we can get all of this data together, and I personally think we can start seeing new medications come to market faster. But we've also seen really great results in congestive heart failure, using device integration with connected scales and connected blood pressure cuffs, and in diabetes with connected glucometers, bringing all this information together in one place and being able to communicate it back and forth to providers and the whole care team.
Perfect. One more question along those lines, and in terms of that data that you just talked about, are there concerns regarding patient privacy when they begin using these mobile apps, this mobile app?
Yeah, so one of the great things, at least with Instant PHR, is that patients are always in control of their data because it is a patient health record. So the patient gets to choose who has access. We have the ability for patients to assign like a guardianship role. So in my account, I can monitor both my son and my dad's account with their permission, well, with my father's permission. My son isn't quite old enough to give his permission yet. But I am always in control of my own data, and I can give access to providers with either a read-only ability or also with the ability to go in and assign action plans or care plans for me and interact more with my data.
Okay, perfect. For both you and Damon, there was four modules, if you will, put up there under the TriBridge Health 360. A couple questions on those. Can those be leveraged individually, or do they have to be leveraged collectively? And then around patient engagement, there's a question if there's a cost to the customer.
Yeah, let me do my best to answer that real quick, and Jennifer weigh in if I missed something. So there were 4 topic areas, yes, up on screen earlier. It's part of the Health 360 suite, which is the TriBridge CRM-powered solution suite for healthcare providers. The answer to the question is yes, you can implement one or all or sequence in those different functional areas across those 4 topics. Oh, thank you for getting that back up on screen. And then the second bit of the question, I think, was, is there a cost to the consumer to make use of the patient engagement tool from Get Real Health that is part of the suite? And the answer to that is no, there's not. The health system is the sponsoring entity for the solution set.
Perfect. And then there was a question earlier on around time to value. If you were going to be standing up the solution or parts of the solution, how quickly can an organization start to realize value?
How quickly can you re-engineer a process and teach people to do work a little bit differently? And I don't mean to be, I'm not facetious about that. That really becomes the gating factor. Is no longer the technology, because this is a cloud-based system that we can stand up very, very quickly. So it really becomes a question of how quickly can we get to valuable use. And to answer that correctly, we have to figure out how we retrain, realign, re-educate people and the processes that they're executing. So we have seen in our customer base, Rich, as quick as 60 days to a usable environment that is actually being used to manage attributed life relationships, to a few months longer than that, depending on the quantity of integrations required and so on, which can sometimes be the other factor that can extend a time to value on the calendar. But generally, less than 6 months, typically a 2-month minimum, I would say.
Excellent. Okay. Jennifer, anything else you'd like to add on that?
No, I think Damon covered that one well.
Perfect. The other question is around mobile information. How do you handle faulty data i.e. persons lying about hours they slept or accidentally submitting faulty information. Does this skew the data and usefulness of the mobile tools? Could this lead to patient safety issues, blah, blah, blah? So
I'd actually love to address that one if I could.
yes.
Patient-generated data is a huge soapbox issue for me. I like to talk about it a lot. I really feel that clinically we really need to start trusting our patients more than we do in trusting the data that they provide. I think the greatest transition, however, as a provider for trusting patient-generated data is device integration, using as many devices as we can, glucometers, pulse oximeters, weight scales that are connected. And then that's trusted data. But I see this, and I don't think this is any different than getting the data from a patient when they walk into the exam room and you ask them the questions, or when they fill out a form. In fact, I think when patients are in their comfort zone with their cell phone in their home, they're going to be more honest than they are sometimes when they're face-to-face in the provider's office. So I don't think it really will skew the information. And in fact, like I said, with device integration, it can actually help make the data more trustable.
Perfect. There is a question here. I know there's value in this, so I'm going to try to summarize this. So there's a question regarding adoption, patient adoption. So, and the question is giving some specific examples of patients that have had chronic illnesses, have been released from the hospital, and then have no care plans, no coordination, and the like. And there's a question: has there been long-term studies against this? Do patients adopt this technology? Anything you can share there?
Well, I think we've seen quite a bit with patient adoption, and I think the key that we've learned is that you really have to give the patient what they want. If you're providing them a solution that doesn't allow them to use the data that they're receiving in a meaningful way and interact and be the center of the care team, they probably won't adopt to it. But if you really do what we're saying and make them the center of the care team and let them know that they're driving their health care, they're much more likely to become engaged and involved and modify their behavior. There is definitely a segment of the population that no matter what we do will never modify their behavior. But if we can at least touch the people who are able to modify, again, by giving them that power, then I think we absolutely see a big difference in the healthcare.
Excellent. Thank you. And I know we're at the top of the hour, so I'm going to end the questions there. There might be one or two remaining that we might have to respond on offline, but I want to thank you both, Jennifer and Damon, for that. It's the first time ever I've seen questions come in where they've actually shared your enthusiasm and congratulated you guys on a great job, so thank you very much.
Thank you.
Thank you. So yes, and thank you to our presenters for their excellent presentation, and for all of you for participating today. We're looking forward to having you join us for future webinars. This concludes today's program. Have a wonderful afternoon.